Alrighty. Okay. My name is Thomasina, and just wanted to make sure. Can you guys see the slides already, or are you just seeing the room? You can see the slides. Okay, fantastic. So my name is Thomasina. I'm the program manager here at JHU Source. I will be your primary contact for the HIV counseling and testing program. Um, we're having an exciting year, and I'm so happy that you're able to join us. I'm going to go ahead and get started. First, I wanted to just let you guys know where we are. So we're right behind the School of Public Health, 2002 McElderry Street here in Baltimore. Our contact information is here on the page, but if you want to learn more about our offices, send us an email or visit our website, source.jhu.edu. And we are your go-to group for any kind of community involvement opportunities, service learning, etc. Our mission here is to engage the Hopkins University Health Professional School and as well as the Baltimore community in mutually beneficial partnerships that promote health and social justice. And today our focus will be on HIV testing and counseling, but just wanted to share a couple of upcoming events that are happening with our group, starting first with this Source Community Involvement Fair, which is going to be hosted on the 25th. And we also have the Baltimore Week activities, starts on October 5th with the Tri-School Day of Service, as well as a myths and tips panel starting on October 8th, and then Taking Care, which is a documentary screening that we're hosting with Healthcare for the Homeless. That will be on Wednesday, October 9th at 4 p.m. We also, just some couple other things that are coming up. We have the JHU Blood Drive on September 26th, and there are other things that are coming up, but subscribe to the Scoop in order to learn more about what we have going on. Any questions so far? Fantastic. So just wanting to share a couple of statistics with you. There, in terms of HIV prevention and counseling, so there were 757 people who over the age of 13 were diagnosed with HIV infection in 2022. 161 of those people were diagnosed here in Baltimore City. And then at the end of the year in 2022, there were 31,648 people who are over the age of 13 living with diagnosed HIV in Maryland, and 32% of that population was living in Baltimore City. Among those living with HIV in 2002, it was estimated that 93% had been diagnosed, with an estimated 2,500 people remaining undiagnosed. And then this kind of is an issue across the country. So at the end of 2002, 1.1 million people, almost 1.1 million people in the United States were living with diagnosed HIV, and Maryland was ranked 14th among states and territories with adolescent and HIV diagnosis rates per 100,000 in 2002. And here we have a bit more of a breakdown of what specifically like a quantitative breakdown of what specifically is being reported here in Baltimore City, which is that it's primarily non-Hispanic Black men between the ages of 35 and 64 who are currently living with diagnosed HIV. And I know a lot of statistics and a lot of these numbers, I'm kind of throwing them at you pretty quickly, and it can be a little overwhelming, but there is good news on the HIV prevention front, specifically that status knowledge and PrEP coverage has increased significantly since 2017, and health outcomes for persons living with HIV have improved significantly as well, with viral suppression up from 45% in 2017 to almost 66% in 2002, as well as linkages to HIV care having increased as well. So that's where our program comes in. We really are working to do our part to support with the HIV testing and counseling position. We're really trying to support the goals of the state, as well as with the general ending the HIV epidemic movement. And both of the clinics that we work with this year support the state's goals of reducing HIV-related health disparities specifically. So the Harriet Lane Clinic works with the disparity amongst youth, and the Pride Center of Maryland works with the LGBTQIA plus community. And so we have representatives here from both organizations to tell you a little bit about what that looks like and what we're looking forward to this year. And they can share information, you can ask questions, and yeah. So going to go ahead and start with the Harriet Lane Clinic. Wanted to introduce yourself, Yang?
Yeah, thank you, Thomasina. So my name is Yang, everyone. My name is, so Yang Yang. I'm one of the HIV testers at the Healing Clinic, and so I do a lot of management supervision of our HIV prevention program, particularly around HIV testing, linkage to care, and discussions around HIV prevention across Baltimore patients. And so we are a primary care based clinic, and so a lot of patients that we come for primary care. So we look at all aspects of health amongst our patients. And we mainly focus on pediatrics, adolescents, so usually from birth all the way to 26. And with HIV testing, we usually have a set demographic. So, 13 and older is kind of our range group. And like I said, a lot of our patients are from the immediate Baltimore City community. And so I think this gives you a really good idea to really work with folks in the immediate community and kind of listen to their stories throughout our program. And we and one of our biggest goals, especially for the HIV testing program, is to really reduce the health outcomes or improve health outcomes among HIV in their population. And we go about that in different aspects, right? So a big part of it is through HIV testing, risk reduction. So we talk a lot about, how do we minimize certain risks and how do we really support development within adolescents. And thirdly, we do a lot of quality improvement projects, right? So how do we really track these data and try to improve our program for maximum reach for HIV in the population. And so I'm going to stop there. I talked a little bit about HIV testing, but I think we'll talk a bit more about that a little bit more. But specifically with the SOURCE program, in recent years, we've usually had about 10 volunteers coming in to test with our program. And that usually involves, interacting with our providers. We have over 10 physicians in our clinic in the adolescent specialty. So I think volunteers get the chance to really network with physicians, with our nurses, and ultimately our patients. And so this really allows for that one-on-one interaction with providers, with researchers, and also with patients. And that covers a span of topics, like I said, with PrEP education, risk reduction, and also understanding quality improvements, what really goes into community-based organizations, especially community-based clinics, and what are the type of programs that are seen in this specific community, and how can you, take different skill sets from working in a community-based organization and implement that to Baltimore or even to your own communities back at home. And so that's kind of what we strive to do is not just with testing, but how do we really expand testing in Baltimore and outside of Baltimore. And so the involvement, so this kind of looks at the requirements or sort of what we expect out of volunteers. And so we usually have, in the mornings, we don't have clinic. And so a lot of our inpatient interactions are in the afternoons. And we do run on the clinic hours, which is usually from 8 to 5. And so in the afternoon, which is usually from 1 to 4, that's kind of the period where we conduct a lot of our HIV testings. But in the earlier shifts in the AM, that kind of allows us to really look at, how does virtual healthcare really influence health outcomes, and that can be in, calling patients for their HIV results, calling in for scheduling. How do we support patients to make it to their appointments, and also provide navigation virtually? And so the morning options, we usually design that for volunteers who sometimes can't make it to in person, and that virtual part of it really allows them to still be a part of our volunteering program. And then you also get to use our data tracking system. So Epic is kind of the Hopkins system of tracking patients and tracking data for everyone that they see. And so you'll have the opportunity to also learn a bit the Epic navigation and how do we look at patients, read results, look at previous notes, and kind of create a background for patients in preparation to see them. And also using that as a platform to network with other providers in the clinic to kind of help triage patients and kind of see where, how we kind of all work together in the clinic.
Fantastic. Thank you so much, Yank.
Yep.
And again, we're going to have space for any additional questions if you have site-specific questions towards the end. And now I want to bring Rashida from the Pride Center of Maryland up. Rashida.
Good afternoon, everyone. I also have Crystal present. She wasn't able to get into the meeting. So we are now currently in a shared space. So she will jump in at any point to add any additional information where she can.
Fantastic.
Okay, let me get back there. So the Pride Center of Maryland, we currently have two major locations with an outreach location for an organization we're partnering with. So our main office is located on St. Paul, and we do have a a clinic, which is identified as our drop-in center, testing center where the HIV screeners / navigators work from. And we do our screenings on Tuesdays and Thursdays between 4 p.m. and 7 p.m. We are also currently partnering with an external organization for additional screening and providing harm reduction services. So we are partnering with another nonprofit on Bond Street to provide those services. So this next slide just gives a general overview of PCOM. So we do service the LGBT plus community, and we do our main office here on St. Paul Street, where we offer group support. We do group evening groups, and we also do our, as I mentioned earlier, our screening, healthcare screening. But our main location is to provide support and services to the LGBTQ plus community, which includes outreach. We do have a group that provides transgender support. They do that bi-weekly. We also have like heart health programs, including we have a yoga camp. We also have self-defense courses. We do have
sexual health, wellness kits. We really try to provide all-around wraparound services for the LGBTQIA plus community. What we're looking for in the interns is to definitely support us in our testing, our outreach. We have some new initiatives in regards to heart health. So we're looking for interns to also support us in that aspect. And then our grand event that we always have every year is our Pride Festival. During the Pride Festival, it's usually a 3-day event, and we test individuals during the Pride Festival. Last year, totaling for 3 days, we tested about 150 individuals. So we're looking to definitely ramp up those numbers and to provide the supports for individuals that do test positive as well, and providing them education and resources within the community.
This is just kind of an overview of what the focus is for the Pride Center. This talks a little bit more about the PCOM specific roles and responsibilities, if you guys wanted to hop in.
Yeah, sure. So at this point, what we're looking for is to provide support to the staff who are conducting the screenings. So essentially, we're looking for additional screeners to support the 2 screeners. Currently, we have 2 screeners, and we have a few staff in the process of becoming screeners. So we're working to, you will be working to support that, as well as helping the clients navigate through any type of healthcare system. What we're looking to do is also refer our clients to additional care, and that's where you would come in to support and assist with that.
May also look at resources and developing more resource guide information as well. Just also trying to re-engage sometimes, individuals that may be tested, whether positive or negative, just need re-engagement and encouragement to interact with different programs and things that we offer here at the Pride Center of Maryland. So we need enthusiastic, energetic students to really come and engage. And then the big population that we're trying to reach is definitely the youth, the 13 to 34. So any references, resources interns may have in regards to that would be greatly appreciated.
And so this speaks to our schedule currently. What we're looking for is Tuesdays and Thursdays at our clinic, as I mentioned, from 4 p.m. to 7 p.m. And there is a slight change for Wednesdays. This will be at our partner organization, and that time is from 10 to 12. And so that's where there will be additional screening done bi-weekly on Wednesdays. And sometimes we have other events like tabling and other events that we have with partner organizations. You'll be notified about that, but sometimes there are other events outside of our standard Tuesdays and Thursdays, as well as Wednesdays for outreach.
Yeah, when we do events, we like to give the opportunity for testing. So we do have a few events coming up next month. One in particular is our Kiki Ball. It's like the second week of October, where we're also looking to have an area where we do provide testing in sexual health.
Right, fantastic. So, thank you both so much for sharing those details about your respective clinics. I just wanted to share a little bit about the program timeline. Specifically, was saying that to participate, you just have to make sure that you are able to complete the required online training modules. And those dates are currently being established, so that's why they're in red now. But as soon as they are available, we'll be sharing them with in the scoop and as well as with the other applicants who are still interested. But you do have to complete them within that time frame that we share. Again, for the Harriet Lane Clinic, there's a minimum of 1 shift a week. And then with a Pride Center, there's a minimum of 2 shifts per month. So based upon your needs as a student and individual, like personal needs as well, those are the times that maybe choose the one that works best for your schedule. And then in terms of like some key program dates to keep in mind, the application will close on October 1st, which is a Tuesday. And then within the next 2 weeks or so, we will be selecting participants for each site. Ideally, at least around 10 per site. And then they have to complete the modules. You'll do onboarding and orientation with either center. And then starting in November and maybe moving towards December based upon when the training is complete, is when you'll start actually being able to do some testing. We're going to have a next term or next semester, February and May, we'll have reflections and time to talk about what you've been going through and how the process has been for you, as well as how you think it impacts how you view the community, as well as maybe we're doing some reflexivity exercises. So seeing how your specific positionality impacts how you interact with the community, just kind of discussing those kind of things. But there will be some reflection later on. And then in May will be your final reflection. However, there are opportunities, as was mentioned by PCOM, there are some opportunities for testing during Pride Month. So if you're interested over the summer, that's something we could also talk about. But first, let's get you through training. The training would include, it's generally an e-learning course, 6 modules with training as well as supplemental sessions with the Department of Health, which are still being established. And then again, this content should be self-guided and it must be completed by October 29th, ideally. Again, further details will come about the finalized dates. And then here we have we wanted to let the opportunity for both sites also to jump in and share anything about site-specific training, maybe starting with Harriet Lane Clinic.
Yeah, for sure. So you guys are kind of already seeing all the different components that goes into the programming with Source and with HIV testing. And so because we are work with Hopkins, we are a part of the hospital system, and so a lot of the trainings will be kind of similar to the health department training, right? How to navigate Epic, which is our patient database, how to go about conducting certain quality assurance metrics, and so testing controls for every week, and kind of interpreting those data. And so a lot of those trainings will kind of put into volunteers who come into our clinic. And we also have trainings about, how do we really prepare our volunteers to talk to patients about risk reduction, and going into the concept of motivational interviewing, how do we really dive deeper into active listening, and asking questions to really support patients in their journey, in addition to, safe sex or any social factors that can influence their decisions. And so a lot of these trainings will be provided by our facility. And then we also have additional staff. So I'm one of, I think, 5 other people that are also testing. And so there's always someone on site to kind of navigate certain situations or scenarios with you, and find, if you need support, I think there's always support there for you as well with training. And it also helps you develop your own style of testing, right? I think everyone offers a different insight into HIV testing, and we really want to understand, um, how do we support you in managing your testing style, and how can you also see how effective that is? And I think that's a big part about this program is, as much we want to teach you all, I think the way you teach us is also very important. And also seeing how different methods of, risk reduction or HIV testing with patients, which, how do we really maximize that with our volunteers, and offer different, capacities and experience with our testing. And so there'll be a lot of trainings around that, and also a lot of reflection with testing programs there too.
Thank you so much. Pride Center, is there anything that you would like to additionally share about site-specific trainings or anything else that will come up at your site specifically?
So for our site, we will go through an onboarding process, which will involve the screeners. So it will involve the screeners monitoring and showing support and providing guidance. But we're currently working through a specific training for this program. So while we currently have an idea, I'm not able to speak specifically right now because we're still working through that, but it will involve an onboarding process with the current screeners.
Fantastic. In terms of establishing student site leaders, as well as scheduling, more information will be coming about specifics. But just in general, speaking about like scheduling, it really is, again, choose a site that works best with your schedule. Make sure you work closely with the site to make sure that your schedule works. And if there's not any changes, you'll have to contact them. And the student site leader is also somebody who can help with liaising that process. So we'll talk further about it as we get closer to those dates, and as the acceptance letters are rolling out, we'll be asking students to work as site leaders. And then again, if you have further questions, feel free to reach out. And then in terms of the application itself, this is a highly competitive opportunity. So there will be like ideally around 10 people per site who are able to support the HIV testing and counseling. And we usually have about like 50 or 80 applicants per year. So it's very selective, and it's not a reflection of you as a student. If you don't get selected this year, there are other opportunities. But basically what happens is that there's a panel review of the applicants. So both the sites will go, and I will go through, and they'll select the students that fit best for them and who also have selected to work at their site. And it really just depends on your written application. We can't give any, unfortunately, even if you contact me directly and tell me how much you want to be, I will have to redirect you to the application online. And we won't necessarily, because of the high volume of applicants, wouldn't necessarily be able to provide feedback on why or why not you are selected. However, if you did have questions or if you wanted support with other opportunities, of course, I'm here for that as well. And then if it ends up there are some students who, based on their schedule, if there's something changes, they're unable to participate, we'll also identify alternatives who are able to participate if someone drops out. All righty. And again, the application deadline is Tuesday, October 1st, 11:59. Visit our website. There's a specific page on the source.jhu.edu site where you can you can directly learn more about what exactly is going on. There's also a link to send us an email if you have concerns. And then just another plug, we have the Source Weekly Service Scoop for all the opportunities that are coming on. There will also be reminders about the application deadlines. You can also check our social media, as well as do one-on-one meetings. Specifically me, the program manager, is the link for individual students who are interested in learning more about the programs and partners that we have at Source. Do we have any questions? That's all we got for you today.
I do have some like previous feedback from students and panelists. I think one of the questions that folks kind of asked or kind of talked about, why did you decide to choose me? Or, what are you guys expecting from us from these applications? And I think that's kind of a hard question, but I think for in the past, we've kind of seen a pattern of, how are students talking about themselves? I think that's a really big something that that we really look to. Everyone that comes to Haken is very very smart and very very able to do the HIV testing program. But I think what kind of makes people stick out is how do you really humanize yourself? Because we really looked at towards that with our patients too, right? How do we identify students who can connect with our patients and know and understand how to navigate certain conversations if they come about. And so I really push you guys to really talk more about not just your accomplishments but also who you are as a person. I think that kind of helps us also resonate with you. And I'm going to be working with some of you people with some of the volunteers quite frequently, and I think that also allows me and my staff to also build that connection as a colleague, but also with our patients as well. Just
Fantastic
a little
advice.
tip for the folks who showed up to this.
Absolutely. Thank you. Well, what about Pride Center? Do you have any special tips or thoughts as you move forward with the application process? Things that people should keep in mind?
Yes.
Oh, just understanding, the population that we serve, the sensitivity to the population that we serve. Just be open. We're looking for people that have the true natural ability to engage folks, because this is a difficult subject matter. This is a difficult process. So we're just looking for people that are really engaging. So if you come with some background with customer service, motivational interviewing, mental health knowledge, that would be great. This is a really fun organization, but we do deal with some very, very serious matters. And so we're just looking for people that can really engage.
Absolutely. Thank you. Thank you both for coming today and sharing a little bit about your organizations. I know that the students, and I especially, since this is my first time leading this program, I really am looking forward to seeing what the volunteers are able to bring forward and how they can support you guys moving forward. That's really all we have for today, though. Did anybody want to ask any questions before we hopped off? Anything that maybe they think later on when they revisit this recording they wanna see and rehear or think about further? Alrighty. Thank you all so much. I look forward to seeing your applications. Absolutely. Thank you for joining us. Really looking forward to getting to know some of you guys further and hopefully seeing all the great work that we've put together. I'm gonna go ahead and stop the recording.